what is Parkinson's disease? Parkinson's disease is a neurodegenerative disease affecting both the central and peripheral nervous systems. It is characterized by the loss of dopamine-producing neurons in the substantia nigra region of the brain. It is classified as a synucleino-pathy due to the abnormal accumulation of the protein alpha-synuclein, which aggregates into Lewy bodies within affected neurons. The loss of dopamine-producing neurons in the substantia nigra initially presents as movement abnormalities. This leads to Parkinson's further categorization as a movement disorder. In 30% of cases, disease progression leads to the cognitive decline known as Parkinson's disease dementia. The 4 cardinal motor symptoms of Parkinson's disease include bradykinesia, slowed movements, postural instability, rigidity, and tremor. A 40-year-old man comes to the office due to a 6-month history of sleep abnormalities, constipation, and generalized slowing of activity. In addition, he has difficulty rising from a seated position. Medical history is significant for a traumatic head injury 3 years ago, which required a prolonged hospital stay. The patient has no other medical conditions and takes no medication. He does not use tobacco, alcohol, or recreational drugs. Vital signs are normal. Examination shows resistance to passive movement in the upper extremities, which is slightly greater on the left than on the right. Left hand tremor and decreased arm swing occur during walking. The most likely explanation for this patient's current condition is degeneration of neurons. This patient has bradykinesia, for example, slowing of activity, decreased arm swing, with an asymmetric hand tremor and rigidity, increased resistance to passive movement around a joint. In addition, he also has sleep abnormalities and constipation. This constellation of symptoms is concerning for Parkinson's disease. Parkinson's disease originates from a loss of dopaminergic neurons in the substantia nigra. This usually occurs gradually, leading to clinical onset typically in the 6th or 7th decade. Traumatic brain injury, especially with prolonged loss of consciousness, is associated with both an increased incidence and an earlier onset of Parkinson's disease. This is due to the accelerated degeneration of neurons both at the time of injury and through ongoing neurotoxic cascades that lead to the accumulation of alpha-synuclein filaments and accelerated neurodegeneration. Astrocyte swelling occurs in the early phase of traumatic brain injury and can lead to cerebral edema and life-threatening increased intracranial pressure. It does not seem to directly contribute to dopaminergic neurodegeneration. Degeneration of oligodendrocytes, myelin-forming cells, leads to demyelinating diseases such as multiple sclerosis, which typically presents with neurologic deficit disseminated in space and time. Disruption of vascular endothelial cells can occur due to shearing forces during traumatic brain injury. This can disrupt the blood-brain barrier, leading to cerebral edema and petechial hemorrhaging. However, it is not the primary cause of Parkinson's disease. Vascular amyloid deposition is responsible for cerebral amyloid angiopathy, which is the most common cause of lobar intracranial hemorrhage. The amyloidogenic proteins are usually the same as those seen in Alzheimer's dementia, but they are not associated with Parkinson's disease, which is associated with alpha-synuclein deposition. Bradykinesia, resting tremor, and rigidity are features of Parkinson's disease, which is caused by dopaminergic neurodegeneration. Traumatic brain injuries can accelerate neurodegeneration. It is leading to a higher incidence and earlier onset of Parkinson's disease.